Thanks. Talk a little bit about the REMS program. REMS, or Risk Evaluation Mitigation Strategies, are drug safety programs the FDA requires for certain medications with potential for serious adverse side effects to help ensure the benefits that the medication outweighs its risks. We operate under the genomics, which is part of the Codex use case. Our goals are to reduce REMS implementation burden, improve the quality of REMS data for feedback and evaluation, and to optimize safe medication use and health outcomes. This year, we're building towards a real-world pilot. So we've in the past we've worked through Connectathons. Have our second STU2 version of our IG. We've built out a lot of the use case, a lot of the interactions, which I'll talk about in a second. And so we're building towards a real world pilot to start with synthetic data, working on test systems within a real EHR system at a site, all the way through to the pharmacy. Starting with a HL7 fire messaging down to NCPDB script for finalizing the medications. So this is a brief look at our timeline for the year that we're in site outreach right now, trying to recruit sites. And we're building towards, getting all the different applications up and running and testing and concluding by September. So our REMS use case defines really, it's the core piece of it is a discovery of what the REMS programs are. So in our most common scenario, the patient is visiting with a provider. The provider prescribes a medication in the EHR, and an order signed CDS hook is sent to the prescriber intermediary. The prescriber intermediary removes fire authorizations. That way it can forward that on to the correct REMS administrator. In the past, usually every REMS administrator has a different program. It could be done manually through faxes, or it could be more commonly it's like a web interface, but they're all different. And the prescriber needs to know where they all are and how to get access to it, how to log in and everything. So this aids in discovering what those requirements are by forwarding the message on to the correct REMS administrator for this given drug. When the REMS administrator gets the hook, it then just sends back cards up the chain through the intermediary to the EHR and presents them to the prescriber with a listing of maybe there's information on what needs to be completed. Part of this REMS program. It could be informational only. It could be just for your awareness, there are these serious risks. Could be cards that have smart links to smart apps, and so those will launch into a shared smart app. And so that shared smart app works similarly to how DTR does the Da Vinci use case. It queries for a questionnaire package from the REMS administrator, and it can build up a form in a common way for completion of collecting the information needed to register patients and the prescribers. And it's able to make use of pre-population using CQL. We're looking here to integrate with PACIO, and what we're looking to do is basically a patient leaves the hospital setting and transitions to post-acute care. The patient would have already had a REMS medication prescribed to them. And so when they're going to this post-acute care in a SNF skilled nursing facility, this transition to care bundle is going to be sent over to that EHR that's within the skilled nursing facility. And then within there, it's parsed by the EHR and finds that there's some medications that have a REMS program and may need to be updated, and this prescriber needs to be updated as the doctor that's responsible for really prescribing this medication. So we then go through the same process we did before. We create a medication request, include it in a CDS hook, and send it on down through a CDS hook. The only difference here this time is that the return coming back, this patient's already been enrolled. So instead of getting patient and prescriber enrollment forms, you're likely just to get prescriber enrollment forms. And that's what we're going to demo.
Share just one slide. This will just give us the quick introduction to the scenario and why this is necessary. So in our scenario for the clinical story, in essence, is a young woman, Violet Gartner, is 17 years old, and she's living. That's just relevant for some of the sample data that's being passed back and forth. You'll see Detroit across many of the providers. And the medication that she's been prescribed is isotretinoin, which is also called Accutane, and that's for a severe acne. The situation that happens is that Violet has an accident while she's mountain biking, and she is taken to the emergency department. Her injuries are severe enough, and she's the scenario is that she's broken an arm and a leg, and she's not able to bear weight in essence, and doesn't have supports at home. So she needs to be transferred to a skilled nursing facility, and she'll be at that skilled nursing facility long enough where the isotretinoin is going to need to be continued and prescribed there. So that prescription is going to be noted from the ED as a home medication. Not that it was prescribed there, but just continuing that knowledge forward in the transition to care document or bundle, excuse me. And that will be received by the skilled nursing facility, and then they'll need to go through and create that prescription. And then the REMS team will walk through how that happens from the skilled nursing facility staff. So with that, I'm going to stop sharing and turn it back over to Sahil, I believe.
Over here, what we have is our first EHR system. It's going to be different from what you'll see later by the screen banner. We're going to be acting as the PCP prior to the accident, where we handed off to the PACIO folks to kind of act as the emergency department, kind of taking care of things. So as the PCP, what we're going to do is we're going to go down and select our patient, which is Violet Gartner. And in there, we have a single request for isotretinoin. We're going to be acting as prescriber Stephen Strange right now, and that's what's going to be sent over to the REMS administrator, basically saying that is the PCP. And later on, you will see that prescriber Jane Doe at the skilled nursing facility, which we have a separate EHR for, will kind of take over. So if I hit sign on this order, you'll see that we get a couple of requirements that need to be filled out. We have the patient enrollment form and the prescriber enrollment form. And if we click on this Itasu button, you can see that we still have to submit those two, whereas the pharmacist that we're using has already been filled out. So I can go ahead and fill these out really quickly. Just in the interest of time, I'll hit this button to ignore required fields, and we can just go ahead and submit this bundle. In practice, the prescriber would actually have to go and fill out every single one of these, but since this is just a demo, we can kind of skip that part right there. And then if I hit my Atasu button over here, you'll see that the patient enrollment form has now been submitted. And then we can also go ahead and do the same thing with the prescriber enrollment form, fill out accordingly as need be, and then submit our REMS bundle. So if we close out both of those, if we now check our Atasu, we can see that everything has been met. This is typically where you would prescribe the medication, the patient would go pick it up, and continue on with their lives until we have that fatal accident that we talked about earlier during the use case, and I will send it over to the PASIO team to kind of take it over from there.
Great, thanks very much. I'll start sharing my screen. Okay, so, as mentioned at the beginning of this, Violet has been in the emergency department after her mountain biking accident, and she is now due to be transferred to a skilled nursing facility for her rehab. And given the anticipated length of stay there, the REMS requirements for her prescription, for her isotretinoin prescription, that prescription information needs to be transferred to a provider at the SNF. So let's bring up Violet's record. And to accomplish this transition, what we're going to do is we're going to create a transitions of care bundle. So let me go into the transitions of care section and create a new transition. So here, this is a transfer summary for Violet Gartner. The author of this is going to be Priya Sarkar, and this is coming from the Metro Hospital Emergency Department. It's a discharge summary. So we're going to now populate the information that is going to be included in this bundle. So as a transition of care, resource. This is going to include all of the things that might be of interest for her care at the SNF. So, we'll include allergy information. She doesn't happen to have any listed, but we'll just make sure that's included. We'll include medications. And here we want to include both the medication list for things she was prescribed at the ED, as well as the medication list for home, which will include that medication with the REMS requirement. We want to make sure all of her problems are included in this, and also some observations that took place at that emergency department. So now that we've selected all the things we want to include in this, we will create the transitions of care. Here we have it listed at the top, January 14th. It's the discharge summary. It's the transfer summary that we just created. And now what we'd like to do is we'd like to go ahead and send a notification to the SNF that basically lets them know that Violet is being discharged, and also that there is this transitions of care information available. So as our destination organization, we're going to go ahead and select the Motor City Skilled Nursing Facility. So this notification, it lets the SNF know that there's that information available, right? It specifically points them to that transitions of care bundle that we just created. And the SNF can then retrieve this information from the emergency department system, which of course now includes that medication information that's going to be needed to trigger the REMS workflow. So before I hit discharge, I might hand my screen share back so you can watch what happens when we send this discharge notification, and see what activities that triggers on the SNF side. So with that, I'll stop sharing.
Sure. And I can take over from here. So if I share my screen again, you can see now I'm back at the skilled nursing facility. And let me just give this a quick refresh, and we'll go select patient. And so whenever you're ready, Peter, you can send the notification over, and we're actually implementing polling against the server for the PACIO server that's supposed to poll and see if there are any new discharge notification requests. And so hopefully once he hits that button, we'll see a notification for getting a new patient and getting all of the medication requests saved accordingly as well. So
Okay.
you
So
want
I have clicked the button. The discharge notification has been sent.
great. And it just took a minute. So you can see I have it set for polling every 30 seconds. So you can see over here, if I hit this button over here, we got 4 notifications come up. We got a new patient that was transferring over to our facility. We got the medication request for Sena, hydrocodone, and an isotretinoin. So I think these are the 2 that were the emergency department themselves. Oh, seems like it got hit again. So we got 2 patients. That's all right. So these are the 2 that were prescribed at the emergency department itself, and this is the one that was prescribed at the very beginning of this demo by the PCP. That information was carried over to the emergency department when they pulled their information for the patient, and then sent over to the skilled nursing facility accordingly. So if we go to our patient select list, well, now see we have 3. We have our original Violet Gartner from the first one, but that was a different hospital. And then we created 2 more for each of the notification requests that just came through. If I hit request medications, you'll see those same 3 medication requests that came through and that we created. What we're actually doing on the back end of this is taking all the medication statements for all the medications that came through and converting them to new medication requests with the new prescriber involved. So in this case, that'd be Jane Doe at the skilled nursing facility. And just to show you that that's different, at the original demo, we only had, whereas now we have these 2 additional medications coming through. So if we wanted to re-prescribe any of them, we could go ahead and sign the order. Okay, I should not have done that. But if we go ahead and want to re-prescribe isotretinoin, for instance, you can see right now all the TASU are approved. But when we go ahead and sign the order, you can see that it changed and that we have to fill out the prescriber enrollment form again. And so the patient is enrolled, the pharmacist is enrolled, like we did with our PCP at the first step. But because our prescriber has changed, we're now using practitioner 1234, which is Jane Doe. Our REMS administrator system picked up on that change and is now requiring you to fill out the requirements again one more time as you're changing facilities and it's a new prescription with a new prescriber. So we can go ahead, click on this prescriber enrollment form button right there, fill everything out as need be, submit the bundle, And then when we come back over here, we can see all of the ATASU are met, and we can continue on with prescribing the medication from there. And with that, that's the end of the workflow, and I will kind of end my sharing of the screen right now. So if you have any questions, feel free to ask, and I'm happy to answer.
So what does the itasu mean? It's like you keep saying that. Can you explain,
Oh,
expand there? Thank
yeah,
you.
so sorry. So ATASU stands for Elements to Assure Safe Use.